Well, if you picture your favorite sandwich meat in a Ziploc, the meat is the muscle and the Ziploc is the fascia.
I'm Jill Angelo, host of the Geneve podcast series for women's health in midlife. I speak with the most forward-thinking experts in the health and wellness industries. These experts are helping women 40 plus feel confident and in control of their health in the most vibrant years of their lives. So join us on this journey of women's health. I'm a huge believer in the power of acupuncture to heal, so I wanted to share more about this ancient healing art with the Geneve community. I got in touch with Jennifer Mason, owner of Vitamin Chi, to help me better understand the mechanism and the magic of acupuncture, cupping, and Reiki. It was, as Jennifer says, a fascia-nating conversation. Listen in. I am here with Jennifer Mason of Vitamin Chi, and we're going to talk about fascia, but that's kind of a word that a lot of people have never heard of. So first, Jennifer, why don't you just tell us a little bit about Vitamin Chi and what made you, what do you do? Tell the Geneve audience a little bit more about what you do.
Well, I'm an acupuncturist, so we do a lot of different things. I think acupuncturist is kind of a misnomer because really the needles are just a small part of it. So we do all parts of health, including diet and mind, body, spirit, herbs. But I called it Vitamin Chi because, well, first of all, I can't resist a good pun. But secondly, I think that it communicates the idea that health is not something very esoteric. You know, I think a lot of acupuncturists, we kind of do this veil of the Tao and Yin Yang and Buddha symbols, but that it's, well, and that's part of it, but that health and Chi is really just an everyday thing, you know, like a daily supplement. So I wanted Vitamin Chi to be kind of natural and healthy and fun.
Tell us about what fascia is, because it's not something that a common consumer talks about. You explain a little bit about it on your website, but explain, what is fascia and why should we care?
Right. Fascia is one of my new favorite things. Picture your favorite sandwich meat in a Ziploc. The meat is the muscle and the Ziploc is the fascia. And so it turns out that we think we have this muscle pain, but a lot of it is actually in the fascia. And the fascia, even though it's so thin and you almost can't see it, you might recognize it if you're not a vegetarian and you've been cooking and there's that kind of film over your meat. That's the fascia. And it doesn't look like much, but it is 6 times smarter and faster than your muscles because it has more nerve endings. And the really cool thing, well, actually there's a lot of cool things. I really find it fascinating.
That's awesome. No pun intended.
I tell you, yeah. They're all connected. So it's this big web, or as we were taught, kind of a train. So that the fascia from your wrist is connected to your arm, is connected to your shoulder. And so this really goes well with acupuncture because if we use the points on the wrist, we're actually affecting the shoulder. And in fact, it goes all the way up to the spine. And vice versa. So when we work on the spine, it's working all the way down the chain.
What is it about the fascia, especially as we age? Why does it become painful? Or what is it about it that, is there a correlation between it becoming more strained and causing pain as we age or not? Or how do you think about why does it become painful over time?
One of the properties of fascia is that it kind of remodels itself. And this is one of the reasons why, when you get up from this interview, you're going to stretch a little bit. Or when we get up from a long plane ride, you just want to stretch that out because we're remodeling the fascia. The body kind of settles into a position. And if it doesn't move for a while, that becomes its new normal. And it thinks, this is the way it is. So when we have these patterns, they can become set. And what I was taught is that after 4 months, this becomes your kind of new normal, your permanent. So when you understand fascia and you can see this pattern that's developed and you know how to move it through, that's what I think is so interesting about it. And that's also why I encourage people to don't wait too long if you're experiencing pain. You don't want that to, you don't want to baby it too long, because then it will become your new pattern, and then it becomes a little bit harder to move through.
It's fascinating around this part of the body that we just don't know much about, because we talk about bones and muscles and ligaments, but not the fascia. What's its role in coordination or strength, or why does it exist?
Well, the fascia, the whole body is connected, of course. That makes me think of another part of our treatment is not just fascia. I mean, I think that fascia is really relevant for joint pain, but there's so many other things that are also embodied. And the reason why acupuncture is good for joint pain, like neck and shoulder pain, is it's not only the fascial knots, and as I was saying, trigger points or motor points. Trigger points is something that was coming out right when I was in school, so in the 80s and 90s. And it was actually, I think, a cardiologist, and she found out that she would have pain, but when you pressed in a different part of the body, the pain would refer. So you might have a headache that's coming all the time, but it's actually this point in the shoulder that when you press on it, it causes the headache. So she realized that when you treat that point, you don't necessarily treat the where the pain is. You'll treat the point that triggers it. I love the trigger points because not only does it make it possible for us to treat things that might be kind of mysterious, but if you understand it as a patient, you can go home and find your own trigger points. I have a manual of self-massage with trigger points, and I love to send people home with that. And then they don't see me as often, but they sure talk about me.
So we've learned a little bit about what fascia is and its role and trigger points. How does acupuncture work with that?
With trigger points, and what I would use are actually motor points, but this is something that's kind of particular to our trade. And they're very similar. The motor points are a point in the muscle where the electrical difference is the greatest, so we have the greatest change. And as an acupuncturist, they're very exciting. Because sometimes there's a person can come in with great pain, and in fact this has happened recently, where somebody came in and they had already had an appointment with their surgeon for knee pain and actually another one with shoulder pain, because they were so sure that it was just so painful. And if you can find exactly the right point, which is our needles are very small, so it's challenging, but when it happens, it's great. The muscle will actually twitch and reset itself, and then the pain is gone and their mobility is back. It's really great.
I'm a huge fan of acupuncture because I've used it and I've had that moment of release when the needle hits the right point, and it's just kind of like your muscle just relaxes. It's quite magical. How do the needles work with the fascia, or do they go through the fascia to the muscle, or how does this work in terms of relieving also chronic pain caused by the fascia?
I think fascia is a component, and understanding fascia is important, but it all works together. So our needles are very thin, and so is fascia. But we'll go right through the fascia to the motor point, and it'll communicate all the way up that fascial line, all the way back up to the spine and brain. But what's great about acupuncture is we're working on other levels as well. So with chronic pain, you often have an emotional component. And acupuncture is actually very good at that too. And also with chronic pain, you may be dealing with things like inflammation and relationships with things. And so with acupuncture, we're able to use points that are not in the same area, and yet connect. So for somebody, actually, my last patient has terrible low back aches. But I could see that from his tongue that he had also a great deal of stress. So I did points on his toes, and that's going to help the emotional release, which is going to help the circulation of everything. Maybe not the fascia, maybe not the blood, but it's all going to work. And in fact, I could see it on his tongue when he left. So it's a little bit complicated. Fascia is definitely part of it, but then there's also inflammation and fluids and emotions and chi.
How about for people who just can't get over the whole notion of needles, because it's kind of creepy. And again, I'm totally comfortable with it. But for someone who hasn't done it and really fears needles, what's your advice to them?
Oh, I totally understand. Even as an acupuncture student, I was a little freaked out. The first time that I was offered acupuncture, I chickened out because I was afraid of the needles. So I do understand. I think that it really helps if you can see them and have a little bit of explanation. They're very thin. If you're used to getting the flu shot, those things are gigantic in comparison. They look barbaric to me because ours are as thin as kitten whiskers. So often you don't feel the needle at all. I use single-use needles, of course, we all do in America, and I'll use a plastic guide tube. So usually what the people feel is the guide tube. I don't know if that's your experience. You feel the guide tube, and then you might feel the needle, but it's not generally painful. And I think that the first time is definitely the hardest. I would recommend anybody who's nervous, especially if you're dealing with something that you want relief for, to give it a try. And we could always do acupressure. We could always do cupping. I offer Reiki, which is not even hands-on necessarily. So there's different options. And for some things, it's the herbs are actually the strongest thing of all.
So let's talk about some of those things. And let's start with cupping, because I think the first time we all saw cupping was at the Olympics in the swim competition. You know, the swimmers had kind of circle suction looking marks on their shoulders and their skin. And can you explain what cupping is and what it actually does to the body?
Cupping is super low tech. It's really just applying suction on different points. So if you understand the acupuncture points, then you might cup over a point. And it's also great for myofascial release. There's two types of cupping. There's the traditional fire cupping, which sounds really exotic. It also looks really exotic. It's a great Instagram post because we put a flame inside of a glass cup and right onto the body. And then it makes a vacuum out of the cup. And so that's how it works, right? It's the ancient vacuum technique. So you just put the flame in for a second. The cup does not really get warm. You won't, it's not, we call it fire cupping, but you won't really experience the fire. What you're just going to experience is kind of this, a little bit of pressure as the cup goes on. And depending on how much vacuum it is, you just get a suction. On a pain, if you are having muscle pain, it could feel a little bit tight, but then it actually feels good. For us, the more purple and red it gets, the better it's working, because you're pulling the kind of stuck blood or inflammation from the lower layers that maybe you can't massage out very well, right to the surface where your own body can take care of it.
Well, let's talk about Reiki. So again, you mentioned you combine multiple techniques based on what the patient needs. Tell us a little bit about Reiki.
Reiki comes from Japan, and it's an energy healing. It is the most gentle form of healing. The idea is that the practitioner can harness the life force and communicate it through their hands to you, which sounds very woo. And I have to admit that the first time I did it, even though I am now a master practitioner, the first time I was offered Reiki, I did it because I was trying to be polite. I was with a friend, and then it changed my life. Reiki's amazing. It doesn't make sense to me. It's not logical. But when you are the patient and you experience Reiki, it's a little bit different for everybody, of course. But what many people experience is kind of a warmth and a feeling of relaxation. And then there's well, okay, I'll tell you my story. I first went for Reiki during my divorce, and it was a a hard time. And I had this lump in my chest that felt like a rock. And it had been there for a few days. And in this Reiki session, when I left, I was really happy and light, and that pain was gone, and it never came back.
Wow. So I think that's just really fantastic. And so you use it over your patients. How do you incorporate it in?
So if people come to me just for Reiki, like maybe a needle-phobe, then I might just do some myofascial release and then just do Reiki. So I'd have them seated or lying down, and I like to put a little bit of guided meditation in it just to help them relax. I like to incorporate a little bit of essential oils. I think it's relaxing and smells good. And then I once I see the patient is relaxed on the table, I'll do Reiki, and I kind of start at the head and I'll move down, and I just feel my palms over their chakras. I kind of feel my hands will reverberate a little bit. I just feel something in my hands to know whether or not it's time to move on. And what a lot of patients have reported is that they feel my hands kind of warm up.
Interesting. Is Reiki something that you learn, or do you have to be as the provider of it in the right place to even deliver it to your patients? Acupuncture is something that you've had training on. You've learned about the, biology of the body and so on and so forth. Is how you learn and are able to do Reiki similar, or it seems like it has such an interesting spiritual component to it that you kind of either have that or you don't, or you have to make yourself available to deliver that. Am I off base?
I think that if you tap into it, that we all have an innate healing power. I think that the feeling of Reiki is very similar to, maybe when you got hurt as a kid and your mom kissed you and made it better. There is an energy transfer there that makes it better, the intent to heal. However, you do need to go to a Reiki class and to be trained by somebody who's been attuned. And as you go through the levels, they give you an attunement, which sounds very mystical and kind of is. There are secret symbols. But ultimately, it comes from, tuning into kind of calming yourself and feeling it flow.
That's amazing. You've mentioned that your focus increasingly is on, or you want to start focusing increasingly on women in perimenopause. Why?
Yes. I feel like women are kind of silently suffering, and then you ask a couple questions and they say, oh my God, I know, right? And I don't know what to do. And I wake up in the sheets and I keep fighting and I don't know, I feel crazy. This is like teenage years again. And our medicine, Chinese medicine, has a different way of looking at the body. So there's a different way of treating the body. So things that don't have a name or a diagnosis in Western medicine, we might see. So menopause traditionally is usually kidney insufficiency. That's what we would call it. And there's a whole syndrome that goes with this. But then you might have kidney yin with heart yin deficiency. That might cause palpitations, or you might have anger issues, and then you put in some liver things. And this affects the acupuncture diagnosis and the herbal diagnosis. So we can get very specific and treat all kinds of things. I'm very excited.
Finally, so with your compassion and focus on women heading into perimenopause, how do you help them know that there's a better way to feel, and then get them maybe over the hurdle of I don't like needles, or it's not covered by insurance, because financial pain is also something to consider. How do you kind of help them understand that care for them is one of the most important things they can do for themselves?
Right. Women we're the caretakers of this society, and it can be really hard to stop and take care of ourselves. But I think because so many people depend on us, it's really not a selfish act to take care of yourself. They say you can't pour from an empty cup. And I see a lot of women are really running on empty. And what they don't maybe recognize is that when they're running on empty, everything kind of grinds to a halt or is a little bit harder for everyone. I think that when you take care of yourself, you are more productive. And also with children, I have children, so I really want to model somebody who takes care of my health and puts myself as a priority. But I'd also like to say that it doesn't have to be that you come every week for the rest of your lives. I think that very often with Chinese medicine, there's a little pattern, and if we can just move it to the right direction, and then we might be able to give you the tools that you can use. Maybe it's herbs, maybe it's supplements, maybe it's a practice that you can use in your own life to keep yourself out of my office and feeling great.
Thank you, Jennifer. First of all, thank you for what you do. And I love your perspective on, just thinking about the body in such a connected way and a spiritual way, and making room for that in our self-care. So thank you for joining us today.
Oh, Jill, it was such a pleasure. Thank you. And thanks for what you do. I love your company and I love your website. I love all of the things you cover. I really think that it's so important for women not to feel alone. And with practitioners or with products or anyways, I think that you have a nice community.
Jennifer, I couldn't agree more. Thanks again to Jennifer Mason of Vitamin Chi for sharing her wisdom with us today. Next up, I spoke with physical therapist Rachel Gelman of the Pelvic Health and Rehabilitation Center, who treats any pain, as she says, between the rib cage and the knees. She has a special focus on the impacts of hormones, and she had some pretty surprising things to say about the effects of hormonal birth control and women in midlife. Stay tuned.
Thanks for listening to the Geneve podcast series. We welcome your feedback at geneve.com. That's GENNEVE.com. You can follow us on Facebook and subscribe to us on iTunes or Stitcher, and you'll never miss an episode. The Geneve podcast series is produced by Shannon Perry, theme music by Smitty. And until next time, watch the Geneve website for new stories and offers all dedicated to women's midlife health.